management skill. The necessary equipment for this skill are field dressing, bandage, tourniquet, high-flow oxygen delivery device, and a blanket. The recommended PPE for this skill are gloves and eye protection. After I've gathered all the necessary equipment, I will attempt to control the patient's hemorrhage by applying direct pressure to the wound, and I'm going to bandage the wound. If bleeding is not controlled with direct pressure, I'm going to apply a tourniquet above the injury. Noting the time of application, I would then properly position the patient and apply high concentration oxygen. I would then take steps to prevent heat loss by applying the blanket. And I would rapidly transport this patient.